on anti-anxiety drugs. What do we mean by anxiety? Anxiety basically is a emotional state where the person experiences uneasiness or worrying or fear due to some defined or undefined threat. Now it can be associated with some physical symptom or somatic symptoms like trembling of the body or palpitation and sweating. So anxiety is an emotional state unpleasant in nature associated with uneasiness, discomfort and concern or fear about some defined or undefined future threat. Now anxiety is common in normal life. A person loses his job, he becomes anxious. How to earn his livelihood next? Or a person seeing a tiger or a lion can be anxious. But treatment is needed when it is disproportionate to the situation and excessive. That is called pathological anxiety, and treatment has to be given. Some psychotics and depressed patients also exhibit exhibit pathological anxiety. Now coming to the anti-anxiety drugs, these are generally milder CNS depressant. Now generally these are the ill-defined group of drugs. Generally benzodiazepines, the drugs that are used as an anti-anxiety are generally benzodiazepines, SSRI or SNRI. Now, the anxiolytic sedative drugs differ markedly from antipsychotics and more closely resemble sedative hypnotics. Generally, sedative hypnotics are used as an anti-anxiety drugs in a milder dose. Now, what are the properties of anti-anxiety drugs? They have no therapeutic effect to control thought disorder in schizophrenia. In schizophrenia, we use antipsychotic drugs. Do not produce extra pyramidal side effects like unlike antipsychotic drugs. They have anti-convulsant property. They produce physical dependence and carry abuse liability, and they do not selectively block conditioned avoidance reflex in animals, which are seen with antipsychotic drugs. Now, what are the drugs, anti-anxiety drugs? These are number one, benzodiazepines, that is the top in the topmost order. Diazepam, Chlordiazepoxide, Oxazepam Lorazepam, Alprazolam. Azapirones are used, Buspirone, Gepirone, Ipspapirone. Some antihistaminic, hydroxygen, beta blocker, propranolol. In addition to the above drugs, antidepressants, particularly SSRI and SNRI, are effective in OCD, obsessive compulsive disorder, is one of the pathological anxiety. In the phobic disorders, panic attacks and many types of severe generalized anxiety disorders. Now coming to benzodiazepines, it is the most widely used anti-anxiety drug. Now in contrast to barbiturate, it has got selective action on the limbic system and thus help in both improvement of both quality and quantity of improvement in anxiety and stress related symptom. Cardiovascular and respiratory depression are minimal with the anti-anxiety dose. They are presently one of the widely used drugs. Now, mechanism of action of benzodiazepine, how they act? Anyone? Mechanism of action of benzodiazepine? जोड़े जोड़े कौन रिसेप्टर काज करे? These are subunit. Basically, they are act on the GABA-A receptor chloride channel complex. যেখানে alpha gamma subunit bind করে. And what does it cause? What does it cause? Chloride channel conductance টা বাড়িয়ে দেয়, frequency of chloride channel opening বাড়িয়ে দেয়. Now, so it has got a GABA facilitatory action. Now, benzodiazepines as anti-anxiety drugs advantage. Number one, they have got little effect on the other body system. Number two, lower dependence producing liability unlike barbiturates and other sedatives. Withdrawal syndrome is milder and delayed due to their longer half-lives. They are relatively safe even in gross overdoses. Now, mechanism of action: facilitating inhibitory GABAergic transmission. Side effects are mild sedation, lightheadedness, psychomotor and cognitive impairment. Confusional state can be seen in elderly. Increased appetite, weight gain, sexual dysfunction. Rashes are uncommon, and women, they may fail to ovulate while on regular use of benzodiazepines. The major limitation of benzodiazepine use for long-term use are potential to impair mental function and physical dependence. Now coming to the benzodiazepine drugs one by one. Chlordiazepoxide is the first commonly used benzodiazepine clinically. Oral absorption slow. Due to longer half-lives, it is preferred in chronic anxiety states, and it is a drug of choice. Chlordiazepoxide is a drug of choice in alcohol withdrawal syndrome. Its T-half is 6 to 12 hours, but active metabolites are produced which extend the duration of action. So it has got longer half-life. Its anticonvulsant action is weak. Now, quickly absorbed, produces a brief diazepam. Now, diazepam has got a dual plasma concentration decay curve. এটা তোমাদের জেনারেল ফার্মাকোলজিতে হয়েছে। এই যে প্লাজমা কনসেন্ট্রেশন ডিকে কার্ভ, এই স্লোপটা কেন আছে আর সেকেন্ড স্লোপটা কেন? These are plasma concentration and these are time. The first slope is due to distribution and the second slope is due to elimination. So here we see two half-lives. One is the distribution half-life and the other is elimination half-life. Now this diazepam, it shows basically dual plasma concentration decay curve. It is quickly absorbed, produces a brief initial phase of strong action followed by a prolonged milder effect due to a two-phase plasma concentration decay curve. Here the distribution half-life is 1 hour and elimination half-life is around 20 to 30 hours. The biological half-life is still longer. Why? Because the metabolism of the diazepam, they produce active metabolites which extend the biological action of the diazepam. It is preferred in acute panic attack and anxiety associated with organic disease. Now coming to the oxazepam, oxazepam is slowly absorbed, it is polar, so CNS penetration is poor, is slow, plasma half-life is 10 hours. Now this drug only undergo phase 2 metabolism by glucuronidation, so no active metabolite is produced, duration of action is shorter, so it is preferred in elderly and in those with liver disease. It is mainly used in short lasting anxiety state. Lorazepam, Lorazepam again CNS entry is slower because of less lipid solubility, slow oral absorption, plasma half-life is shorter 10 to 20 hours, and like oxazepam it undergoes only glucuronidation, so no active metabolite is produced and they are suitable for older patients. On intravenous injection, the sedation effect is quite sound and is capable of producing marked amnesia. Now they are the only benzodiazepine recommended for intramuscular use. They are preferred for short lasting anxiety state, in panic disorder, obsessive compulsion disorder, tension syndromes, psychosomatic disease, and also intravenously as in status epilepticus. Status epilepticus a drug of choice কি আছে? হ্যাঁ, intravenous lorazepam. আর কি ইউজ করা যেতে পারে? diazepam can be used, but lorazepam is preferred. আর কি ড্রাগ ইউজ হয় status epilepticus এ other than benzodiazepine? হ্যাঁ, না, ফসফেনিটয়েন, If fosphenytoin is not available, then phenytoin. Now coming to alprazolam, is another benzodiazepine. Now this drug has got a slight or has got some mood elevating action. So this drug is used in patients of anxiety associated with depression, okay, because they have got some antidepressant action too. Good response has been obtained in panic disorders with severe anxiety and autonomic symptoms. They can also be used as hypnotic. Now, when the alprazolam is used for prolonged period, in between the two doses, the patient may show symptom of anxiety. That is anxiety in between the doses, which can be managed by use of sustained release tablet. Withdrawal symptoms may be more marked on discontinuation of the therapy. Now coming to the next group of drug, that is Buspirone. Buspirone is basically a newer non-benzodiazepine, non-sedative anti-anxiety drug. Now it is used in only mild to moderate anxiety disorder. It has got no effect on severe anxiety. In those, it can also be used in panic reaction and in obsessive compulsion disorder. The action is slow and the maximum benefit is achieved in 2 weeks. Now, how does it act? Basically, it has got a selective agonistic action, partial selective agonistic action on 5-HT1A receptor. They act on the presynaptic 5-HT1A receptor and decreases the serotonin release, and thus has got decreased the activity of dorsal raphe serotonergic neurons. They have also got some antagonistic action on the postsynaptic 5-HT1A receptor. Again, they have got weaker dopamine D2 blocking action. Although it has got weaker D2 dopamine blocking action, it does not show any antipsychotic effect. It has got no extrapyramidal side effects. Now, rapidly absorbed, extensive first pass metabolism, bioavailability less than 5%. One metabolite is active, excretion occurs with both urine and feces. Half-life 2 to 3.5 hours, side effects are minor. Though most patients on Buspirone remain alert, but driving, machinery operating motor vehicles should be cautioned. Now, advantage with Buspirone, it does not produce significant sedation or does not cause cognitive decline or impairment. They does not interact with benzodiazepine receptor or modify GABAergic transmission. They do not show any physical dependence or tolerance. They does not suppress benzodiazepine or barbiturate withdrawal syndrome. They have got no muscle relaxant or anti-convulsant activity. Beta blockers. In the beta blockers, mainly propranolol is used as a anti-anxiety drug. So, many symptoms of anxiety have got two type of symptoms. One is the psychological, that is worrying, anxious, fear of something, and one is somatic symptom, that is basically palpitation, sweating, trembling of body and others. Now, beta blockers, they take care of those somatic symptoms of anxiety. So, these are basically due to somatic symptoms are basically due to sympathetic overactivity, and these symptoms reinforce anxiety. Propranolol and other non-selective beta blockers, they help anxious patient troubled by these symptoms and provide symptomatic relief, but they have got no effect on the psychological symptom such as worry, tension and fear. They are valuable in acutely stressful situation, and they may be used for performance and situational anxiety. Now coming to treatment of anxiety. Anxiety is a universal phenomenon, and to experience it is in appropriate circumstance is a normal response. However, if anxiety symptoms are frequent and persist in a severe form, then causing a distress, suffering and markedly impairing performance, then treatment should be considered. Anxiety should be treated with drugs only when it is excessive and disabling is in its own right. Now, what are the drugs? Benzodiazepines, that their action is quick and they are used mainly in the acute anxiety state. And for chronic anxiety state, SSRI, SNRI and Buspirone is there. Now, benzodiazepine should be used in the smallest possible dose. The dose has to be benzodiazepine should be started in smallest possible dose, gradually up titrated as per the response. The drug should be withdrawn as soon as it is no longer required. But when benzodiazepine is used for a longer period in large doses, the withdrawal should be gradual because sudden withdrawal can cause rebound anxiety. Long-term use of benzodiazepine is of questionable merit due to cognitive impairment and risk of dependence. The two major drawbacks of benzodiazepine for the long-term use of anxiety are cognitive impairment and risk of dependence. The usual practice is to give half to two-thirds of dose at the night time so that the sleep quality will be better, and the rest of the dose is divided in daytime in 2 to 3 doses. Though the half-life of benzodiazepine are longer, divided daytime doses or SR tablets are required to avoid high peaks. Now, Buspirone is a non-sedative alternative to benzodiazepines for chronic treatment of less severe form of anxiety. Now, the SSRI are preferred in chronic anxiety states. These are the drug of choice. So, SSRI and SNRI are now extensively used in most forms of chronic anxiety disorders, but are not good in acute anxiety. They produce a delayed response and can be combined with benzodiazepines. একটা patient anxiety, chronic anxiety নিয়ে এসছে, if we start with SSRI or Buspirone, their action is slow. So, for a short period, we can combine it with benzodiazepines. The SSRI are now drug of choice for social anxiety, OCD, eating disorder and post-traumatic stress disorder, in which benzodiazepines, though effective, they carry abuse potential on long-term use. Now, panic attacks are initially treated with benzodiazepines, rapidly acting benzodiazepines like Diazepam, Alprazolam, but benzodiazepines are not suitable for long-term use. So, what we prefer, SSRI and duloxetine. Name some SSRI. Selective serotonin reuptake inhibitors. কিছু ড্রাগের নাম বলো, হ্যাঁ, এখান দিয়ে এই রো থেকে সেলেক্টিভ সেরোটোনিন রিআপটেক ইনহিবিটরস, নামগুলো জানতে হবে। অ্যান্টি ডিপ্রেসেন্ট তো হয়েছে, নেম সাম অ্যান্টিসাইকোটিক্স এখান দিয়ে, নেম সাম অ্যান্টিসাইকোটিক্স, নাম তো জানতে হবে রে। SSRIs like escitalopram, citalopram, okay, fluoxetine, fluoxamine and others. So, SSRIs, selective serotonin reuptake inhibitors, duloxetine is an SNRI, are the drug of choice for sustained treatment, which in the initial few weeks may be supplemented with benzodiazepines. Valproic acid is an alternative to SSRI in the treatment of panic attacks. Phobic disorders. Phobic disorders are mostly treated by a SSRI such as paroxetine, fluoxamine, sertraline. In situational phobias, propranolol may be added as and when required, and gabapentin is an alternative to SSRI. Patients with hypertension, peptic ulcers, inflammatory bowel disease, GERD, thyrotoxicosis can often be given low doses of benzodiazepine along with the specific therapy, though anxiety may not be a prominent manifestation. Now, some MCQs related to anti-anxiety. Which of the following is a non-benzodiazepine anxiolytic that does not cause sedation or dependency? Which anti-anxiety drug, not benzodiazepine, that does not cause sedation or dependency? Alprazolamটা কি আছে, কোন গ্রুপ অফ ড্রাগ? হ্যাঁ, benzodiazepine, right? So, it will show dependence, it will show basically sedation. Buspirone is a anti-anxiety drug. It is not benzodiazepine. It does not cause sedation. It does not show dependence. So the answer is Buspirone. While Diazepam and Lorazepam again both are benzodiazepines, showing showing dependence and having sedation. Which drug is preferred for long-term management of generalized anxiety disorder? Sorry? দাঁড়িয়ে বলো একজন কেউ, এখান দিয়ে কি হবে? escitalopram. কেন? SSRI group. So they are preferred in chronic anxiety states. So it has been asked for long-term management of generalized anxiety disorders. যদি acute anxiety state হতো তাহলে benzodiazepine preferred. Now what is the mechanism of action of benzodiazepines? Good. GABA-A receptor antagonism করে না, serotonin উপরে কোনো অ্যাকশন নেই, dopamine উপরে অ্যাকশন নেই. It's a positive allosteric modulation of the GABA-A receptor. Why allosteric modulator? Why allosteric modulator? What do you mean by allosteric modification? This is because benzodiazepine, they bind to the GABA-A receptor complex at a site different from where GABA binds it, right? So it is a positive allosteric modulation of GABA-A receptor. General pharmacology পড়তে হবে রে, হ্যাঁ. Which of the following benzodiazepines is commonly used for its fast onset of action in panic disorders? কে বলতে পারবে? প্যানিক ডিসঅর্ডার, ফাস্ট অনসেট অফ অ্যাকশন, তাড়াতাড়ি কাজ কে করবে? বেনজোডায়াজেপিনস. এখানে বেনজোডায়াজেপিন কি আছে? Alprazolam, Diazepam, and they are rapidly acting benzodiazepines. So both 2 and 3 will be the answer. Buspirone has got delayed onset of action around 2 weeks. Which beta blocker is frequently used to treat somatic symptom of performance anxiety? Somatic symptom মানে কি হয়? In anxiety, what are the somatic symptoms that are seen? What are the somatic symptoms that are seen in patient of anxiety? মানুষ ভয় পেলে কি হয়? বুকটা ধড়ফড় করে, তাই তো? মানে কি হয়? প্যালপিটেশন হয়. আর কি হতে পারে? শরীরটা কাঁপতে পারে, তাই তো? ট্রেমলিং অফ বডি হতে পারে. আর কি হতে পারে? ঘাম দিতে পারে. There may be increased sweating. These are the somatic symptoms of anxiety that occurs due to sympathetic overactivity. So what they have asked, which beta blocker is frequently used? Now their non-selective beta blocker is used, preferably propranolol. So not metoprolol, is also a beta blocker, but selective beta blocker. Non-selective beta blocker, propranolol is used. Atenolol again selective, esmolol selective. Esmolol is used কোথায়? Esmolol use of esmolol, it is used to differentiate between myasthenic crisis and cholinergic crisis. Why only esmolol is used? Why not other beta blocker? Sorry ভুল বললাম, ভুল বলেছি, ওটা আলাদা, সরি. So basically propranolol is the drug of choice to treat the somatic symptom of performance anxiety. ওটা অন্য ড্রাগ আছে রে,